Welcome to the 5-Second Rule podcast. We are your hosts. I'm Lerenza Howard, and my preferred pronouns are she, her.
And I'm Kelly Holmes, and my preferred pronouns are also she, her.
We have a phenomenal episode in store for you today. Today we have two guests, the first being Gail Fraine, who is the System Director of Infection Prevention for Ascension Saint Thomas in Nashville, Tennessee. For over 30 years, Gail has led efforts to prevent the spread of healthcare-associated infections in a variety of settings, using evidence-based guidelines, standardization of practices, and principles of high reliability and patient safety. Gail was an APIC Board of Director, Chair and Co-Chair of the Annual Conference Committee, and other various national committees, and is an active member of the Middle Tennessee APIC chapter. For the Certification Board of Infection Control and Epidemiology, otherwise known as CIPIC, Gail is a board director and the current president-elect. She served on the first test development committee for the long-term care certification, the CIPIC recertification from review committee, and the task force for the development of the advanced leadership certification in infection prevention and control. She received an associate degree in nursing from Arkansas State University, a Bachelor of Science degree in nursing from Belmont University, and a master's degree of management for healthcare from Vanderbilt University. Gail is board certified in infection prevention and control and long-term care, as well as the advanced leadership certification in infection prevention and control.
And I would like to introduce Mayar Al Mohajer. He is a professor in the Department of Medicine, Section of Infectious Diseases at Baylor College of Medicine in Houston, Texas. He serves as chief of the Infectious Disease Section at Baylor St. Luke's Medical Center and holds the role of Medical Director for Infection Prevention, Occupational Health, Diagnostic Stewardship, and Antibiotic Stewardship for both Common Spirit Health South Region and Baylor St. Luke's Medical Center. Dr. Al Mohajer is also CIC, LTC-CIP, and AL-CIP certified, and he is the current treasurer for CIPIC. Welcome, Gail and Dr. Al Mohajer.
Welcome to the show. I'm very excited to talk about this topic because I'm very curious to know, of course, CIPIC has the existing certifications, of course, CIC certification. So tell us and really go into detail as to why CIPIC decided to create this advanced level certification.
Thank you, Lerenza. Thank you, Kelly. We developed the Advanced Leadership Certificate in Infection Prevention, or the AL-CIP, to address an important need in our field. So we all know that the CIC certification has a long standard as the gold standard in the field in terms of validating the essential expertise and experience in IPC. However, as the field has evolved, we recognize that infection preventionists are also increasingly called upon to demonstrate advanced leadership skills, strategic thinking, advocacy, and organizational influence. So the AL-CIP isn't meant to replace or diminish the CIC. It is intended to complement it, focusing specifically on the leadership competencies that are essential for the IP, who want to shape the institutional policies, who want to guide the interdisciplinary teams, advance the IP agenda within their organizations. So our goal is to acknowledge these higher level skills and support our IPs in taking their careers and their profession to the next level.
For all of our listeners that may be having this same question, could you tell us why should someone obtain this certification if they already have their CIC and or their LTC-CIP?
So that's an excellent question. The CIC and the LTC-CIP certificate, they both validate your core expertise and practical skills in IP, that you have critical components of success. However, the AL-CIP goes a little bit further in specifically targeting the advanced leadership competencies in strategic thinking. So for the professionals who earn the AL-CIP, they gain formal recognition of their ability in terms of that they lead complex IP initiatives, in terms of their influence, the decision making in the organization, they advocate for higher levels, and they also drive meaningful change in the healthcare system. So it's really particularly valuable for the IP who want to position themselves as leaders, not only within their institution, but also in the broader community. So in short, while the CIC and the LTC-CIP confirm your expertise, the AL-CIP distinguishes you as a strategic leader, capable of shaping policies, driving innovation, and also mentoring the next generation of IPs.
Thank you for that, Dr. Mayar. So as it relates to CIBIC's strategic plan overall, understandably, thank you for noting the fact that it complements the CIC. However, how does the AL-CIP, how does that support CIBIC's strategic plan?
The priority in CIBIC's strategic plan is to promote the value of demonstrated infection prevention competence with a focus on activities that increase awareness of the value of certification related to impact, career progression, professional development, and compensation. The AL-CIP is an alignment of certification opportunities along one's career path, progressing from novice to mid-career to expert with the AL-CIP. In the strategic planning for the AL-CIP, subject matter experts were recruited and a practice analysis was completed. A criteria matrix was developed by the subject matter experts using psychometric standards with the primary domains for leadership and professionalism. Competencies and sub-competencies were defined for each domain as the framework for the portfolio. Beta testers were recruited to ensure the portfolio process was functional, valid, and reliable before full implementation. Using psychometric standards, a rubric was developed to set the passing score. 3 judges score each portfolio with a final review with a psychometric consulting group to ensure integrator reliability with scoring. The development of the AL-CIP was a 2-year process before formally launching the certification.
Wow, 2 years. You guys really thought this through, and I'm really glad you brought that up, Gail. Could you please explain to us why you decided to go the portfolio route versus a more standardized exam?
Yes, during strategic planning and development of the AL-CIP, the CIBIC Board of Directors determined the certification would be a portfolio submission instead of an exam. This allowed the applicant to submit their work as a leader in infection prevention and control, demonstrating their contributions and measurable impact in their career. For me, this was the next progression in my career to demonstrate leadership abilities and competence to influence meaningful change in healthcare.
This brings up a great point for me to highlight the fact that Kelly, the co-host Kelly Holmes, she actually successfully obtained her AL-CIP. So I just wanted to, send a kudos to Kelly's way, for the phenomenal work and contribution that she's, had and the impact that she's had to the profession. So Kelly, provide us with a high-level overview of your experience in submitting your portfolio.
Well, I was nervous, Lerenza, let me tell you. It was, I remember sitting on my couch with my computer in the dark, and thinking, can I do this? Can I do this? And I just started kind of hacking away at it, and I watched all of the videos that the CBIC put on their website. So I believe it was Jessica's voice that was leading me through, and I did exactly what she said. As far as, I took each question and I plugged it into like a Word document of my own, and then I started working on my rationale and then picking out the pieces of evidence. And it was actually really rewarding to kind of take that walk through the past and thinking about how each of these work products met this particular element of the certification. So it was a lot of work, but it was incredibly rewarding. So I highly recommend it.
Yeah, congratulations to you. And I know that LinkedIn and the social media outlets there was a light of everyone announcing their certification. So congratulations to any of the listeners that have successfully achieved this designation.
Thank you so much. And yes, for everybody listening, just do it. I highly recommend it. So Gail and Dr. Mayar, please let us know, how do you feel like leadership is defined in the context of this particular certification?
First, Kelly, let me also say congratulations for this great honor.
Thank you.
That's
Thank you.
really amazing. And second, I want to say that from the context of our certification, we define leadership as the ability to inspire individual and also organizational excellence. We want to see how people creating a shared vision and also successfully manage change in the organization to achieve their strategic goals. So the infection preventionists and control leaders, we want them to use their skills and establish clear vision and strategic direction to facilitate change, to improve the IPC programs and practices. We also define it as enhancing individual population health in order to reduce infection across the lifespan in any setting.
Thank you for that. I know there's been a lot of questions that we've received about the AL-CIP and, just some differentiations from, how this differs from the fellows designation, right, or FAPIC. So share some details as to what are the differences between the AL-CIP and the FAPIC designation. What are the differences between the two?
Kelly, I would like to congratulate you
thank
as well
you.
on your AL-CIP, and anyone that's listening, that's exciting. I'll take that one. Obtaining the AL-CIP validates your leadership skills and impact related to infection prevention and control, focusing on the past 10 years of your career. This certification incorporates professional standards, including accountability, inclusivity, service orientation, and a commitment to lifelong learning and improvement while influencing others in the journey.
And I want to add, to Gail as also a fellow as well, that the FAPIC designation recognizes exemplary APIC members. So according to APIC, the fellow of APIC status is a distinction of honor of IPs who are not only advanced practitioners of infection prevention practices, but also leaders in the field. But where the fellowship denotes an honor, the certification offers a level of attestation of the level of achievement.
Oh, thank you. I feel like that was a very good description of the distinction between the two and how they represent, two different areas. So in what ways does the certification help elevate infection preventionists into strategic leadership roles? So as IPs are considering this type of certification, how can they leverage that in their profession to achieve these leadership roles?
So that's a good question. So the AL-CIP certification is specifically designed to equip and empower the IPs with the skills needed into strategic leadership in healthcare. So achieve that in a few ways. So first, it focuses explicitly on the advanced competencies, so such as strategic planning, policy development, advocacy, and organizational influence that goes beyond the traditional IP skills. Second, the program emphasizes communication, so the soft leadership skills, such as stakeholder engagement, and teaching the IP how to effectively advocate for IP priorities with senior leadership, with clinicians, policymakers, and interdisciplinary teams. So the third point is the AL-CIP validates your ability to drive complex projects and strategic initiatives, and it positions you clearly as a leader within your institute and beyond. And finally, by providing practical tools and framework and a supporting network, the AL-CIP helps the infection preventionists become influential voices who can actively shape healthcare policies, improve patients' outcomes, and also inspire systematic changes for IPs nationwide.
I think that that's an amazing point, and that's something that we are hearing within the profession, right? We want to widen the access to leadership opportunities beyond, at the C-suite level, right, within our profession. And I think that this is a great bridge to that, to bolster and show the strategic thinking skills of the respective leaders that obtain the AL-CIP. So say, for example, for listeners and including myself, those that may consider obtaining this designation, the AL-CIP, in the future, Could you tell us more about what a successful portfolio from your purview? What is a successful portfolio? And in addition to that, what resources should one utilize while they're building their portfolio?
The AL-CIP is judged based on measurable impact of the work in infection prevention and control. Some tips for submitting a successful portfolio include review the CIPIC handbook, criteria, and FAQs in advance of developing your portfolio. Assess your work. For example, I completed a personal assessment of my work experiences and compared those to the AL-CIP framework to determine the selection of competencies and sub-competencies for my portfolio. Tell about your great work. State the problem or project and what you did, who was involved, and define your outcomes. Keep in mind the outcomes may not always be positive success, but tell the story. Ensure that your rationale and evidence align. The rationale should be clear, well organized, thoughtful, and aligned with supporting evidence. Give yourself plenty of time for a successful submission. I would suggest preparing in advance before applying for the certification. For example, determine the topics you plan to submit, like you discussed, Kelly, and prepare your rationale and evidence, and save in a document that you can upload when you are prepared to submit your portfolio.
And to build more on that, I also want to mention that there's few documents that you want to consider when you're preparing for your AL-CIP. You want, for example, to have some project examples, detailed prescription, the description of 2 or 3 strategic infection prevention initiatives, for example, that you've led, have like your clear goals, your role there, the measurable outcomes. That's a really good piece to include. Also, have your evidence of influence. Could be documentation showing your ability to effectively engage with the senior leadership or interdisciplinary teams, such as meeting summaries, strategic plans, policy changes that's influenced by your advocacy. Also include anything that you have for professional development, proof of your ongoing leadership growth, such as any other certification or leadership training or records relevant to educational sessions that you attended. And when you assemble your portfolio, in addition to what Gail mentioned, think about, do you have any other templates or webinars that's offered by CIPIC, for example, to focus on portfolio building and strategic leadership. And don't forget the importance of mentorship or peer support from people who are experienced in the field, who can review your portfolio and offer you feedback. And finally, I want to mention that your portfolio does not have to be very long at all. You just have to powerfully showcase your growth as an infection prevention leader and your direct impact on improving outcomes.
I had a question because, I've encountered some amazing and phenomenal IP professionals, and some are very shy and timid. They do not give themselves the credit that they should and don't recognize necessarily the impact that they're making in the profession and within their respective facility. So can you share some advice to listeners on, identifying some of the impact that they've made and how to formulate that into a portfolio that they can submit and really showcase the work that they've done within their IP, their experience as an IP?
I would like to share one project that I submitted for the portfolio regarding the implementation of a rapid improvement process that was successful in reducing and preventing CLABSI events in hematology oncology patients. Several opportunities were identified in the deep dive improvement process. After engaging the team and implementing interventions, the SIR was reduced by 90%.
Wow.
Thank you for sharing, Gail. I can add maybe another examples. So what we've done, project that I included in my AL-CIP portfolio as well. One of the things I focus on in the quality improvement component was a project we did to reduce urine culture utilization. So we created in our electronic health system an order set to guide clinicians to the UA with reflex rather than just plain urine culture, and we also linked it with criteria for urinary symptoms. So by doing so, we were able to reduce urine culture in the organization by 40%, and we also reduced cost by $500,000 every year. So that would be, for example, some of the projects that people could submit that really highlight not only your involvement in the project, but also the results and the impact on the organization as a whole.
Right. I think that that's a very important point, that it really gives us the opportunity to really showcase the impact that some of the initiatives that we collaborated with, multidisciplinary groups, what impact that has subsequently had on our organization. So thanks for sharing that.
Yes, thank you for both of those excellent examples. So now that you've been through the first cycle of the certification, could you give us any insight into what are some of the reasons or common pitfalls why a portfolio would not be successful? And then what is the process if a person's portfolio submission happens to be unsuccessful?
An option is available to resubmit the subcompetencies that were unsuccessful. Retakes may be conducted within the next 2 application cycles at a cost of 50% of the initial rate.
And in terms of the pitfalls, I can say some of the things that we've seen is maybe submitting your CV as an evidence. So that's something we probably would certainly discourage people from submitting your CV, and then we're not going to go and look at like 30 pages or 10 pages CV and we're trying to match the rationale with the evidence. So we want you to write a little bit about your rationale, but ensuring that your piece of evidence specifically connect with it. The other example is submitting just a certification and say, I have the certification, for example, in quality or safety, so that is an evidence. That is would not be sufficient. So you want to really highlight what you're doing, rationale connects to these components, and also have a specific piece of evidence that really match with it, and to show that your involvement.
Oh, I think that's so helpful. Thank you both.
Absolutely. So I previously noted that on my LinkedIn feed, I saw a flood of IP professionals that posted this amazing designation, and again, congratulations to those individuals. But I'm curious to know, what is the makeup or the composition of those individuals who were able to be, to successfully achieve this designation?
So I can start that. We had now over 100 people who are certified with AL-CIP from 10 different countries. So we have United States, Canada, Saudi Arabia, Malaysia, Pakistan, UAE, Argentina, Lebanon, Ukraine, and Singapore. So we have applicants from also a variety of practice settings and also from geographical representations.
That's amazing. Definitely a global impact in alignment with, APIC's overall mission. And then also, what are some pertinent deadlines that listeners should know about as far as the AL-CIP?
The next application cycle will take place July 10th through August 15th of this year, and the first application cycle for 2026 is January 20th through March 2nd.
Okay, that's wonderful. So can we expect it to be twice a year in frequency? Is that when the windows will open up, or will there be more frequent times when people can apply for their AL-CIP? Or is it always twice a year?
At this point in
It's
time,
twice a
we're
year?
offering twice a year.
Okay, that's really, really helpful. So to just bring it home for our listeners that do have their CIC and their LT-CIP, who might be considering this next step in their career progression, why is it important for them to consider getting this additional certification?
Well, I would consider your career path, the growth opportunities, and leadership ability with measurable impact to potentially elevate your career. I feel like the AL-CIP is the next pathway in the certification process.
I agree with Gail. I think this is a great change to highlight your success and also would help you propel your career growth.
Thank you both so much. It's been a pleasure having you both on the show and listening and learning from your insights about this amazing designation, the AL-CIP. And hopefully listeners can really understand the differences between the existing certifications and how this designation can bolster and advance their leadership skills within respective organizations.
Yes, and you provided us with so much great information to help maybe take the jitters out of, this process for people who are interested in applying. I cannot wait to see the next flurry of LinkedIn posts on who is successful. So thank you so much for your expertise and for stopping by the podcast.
Thank you.
Thank you both.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.